All right, Dr. Dobracki, welcome to the show.
Thanks for having me, Anthony. It's a pleasure to be here.
Yeah, for sure. So I'm really curious your story about natural health and how you got into space in the first place in terms of holistic dentistry and all the results you're getting these days.
Sure. Yeah, I'd be happy to share that. My story is a little bit unique just because I grew up in Europe where we just inherently lived a more holistic naturopathic lifestyle, farming, shopping at farmers markets, just inherently organic produce, and kind of carried that lifestyle over when my family moved to the United States. And my parents are both physicians, so we've always been pretty health conscious and maintain that diet and supplement standpoint. Um, as I got older, dentistry sort of gravitated towards me because of the ability to combine art with science, with healthcare, and being able to help people, especially people who are in pain and almost having like an immediate um, gratification, satisfaction for those patients when they come in. And just that great thing about dentistry is establishing lifelong connections with patients and families. Um, when I was in dental school, though, I was just kind of going through the motions, jumping through the hoops, not really paying attention too much to material science and other options. I also was a professional, semi professional snowboarder at the time. And so I would leave school a decent amount for competitions, off in Utah and Colorado, California. And I was in Colorado. I was actually on a train back to Denver from a competition, and I had my dental school notes. And I was studying for some kind of exam for clinical science. And I was sitting in a train booth, and there was a guy who sat down with me and is kind of staring at my notes, sort of looking at me. You could tell he sort of wanted to say something. And so I opened up a conversation. And turns out, long story short, this guy's name was Hal Huggins. Hal is probably one of the founders, pioneers of holistic dentistry, really analyzing what we're putting in our body, how it impacts it. I mean, he's been doing this for a really long time and been a really advocate proponent for it. And I was studying something in regards to how to prep a tooth for an amalgam filling. And so he started very kindly asking me pointed, educated questions in regards to if I realized, what was in the fillings and the side effects of it. And at that point, I was pretty naive and dumb. I was just trying to, pass my tests and get through school. But it really shook me and rattled me because once he brought up these things and he brought up a lot of links to systemic issues and cancers and autoimmune things. I mean, at first I'm like, I'm just trying to study. Who is this guy? He's crazy. I just, I'm just trying to get through this. And then I got home and still did my test, did great on my test, but then just did a deep dive into PubMed and Google and just started to really look at dentistry and just systemic implications of it. And I was like floored and blown away, just really looking at what we potentially can put into people's bodies, and at what rate, and with no testing and understanding people's genetics and methylations. So many things are unaccounted for, that even though I was young and in dental school, I got a medical note saying that I had a heavy metal sensitivity, so I never did another amalgam. I was probably like a sophomore, and actually to graduate, you have to do a lot of amalgam, which are the mercury-based fillings test cases. And so I actually got medical clearance, just so I never was around it. And that was a long time ago. And even to this point now, I have not placed another amalgam in a human being. Um, and that's kind of what spiraled the journey. That's what started it. In dental school, there is no holistic education, no biological education. There's material science, but it's morely looking at longevity, mechanics, rigidity of things, and aesthetics. And I didn't have much guidance at that point other than Hal. And he and I actually stayed in touch until he passed away, probably like 10 years ago or so. And I've talked to his predecessor for a little bit too. But during that time, Holistic Dental Association became a little more popular. International Academy of Oral Medicine and Toxicology became more prevalent. And I was really fortunate to get invited to a conference and had a couple older dentists mentor me. in regards to where they were with holistic dentistry at the time. And actually, before even graduating dental school, attained certain certifications and education levels from those associations, which transpired back into my clinical practice. Now I'm still pretty active and advocate for those. I'm actually next week going to a Collaborations Cures conference, which is a dental functional medicine type collaboration, really looking at a lot of the systemic correlations, airway impact, and oral microbiome and GI microbiome type studies and education. So you're seeing a lot more of that now. But that's kind of how the journey started. It was just a by chance thing where I sat next to a guy in a train who blew my mind, and it really made me look at my lifestyle and how it didn't align with some of the things I was doing as a healthcare practitioner. So I just wanted to inherently have those two coincide. And once I really learned more about material science and some of the toxicity things and biocompatibility, if I would only put something in a patient's mouth if I felt comfortable putting in a family member's or one of my children's mouths.
Yeah, that's awesome. It's interesting how things align like that, where you just kind of change the trajectory of your path. So yeah,
Oh
it's
yeah.
kind of really interesting. Yeah. So let's talk about like what is biological dentistry or holistic dentistry as a whole? Because I know that there's some distinct differences between conventional dentistry, and most people just don't know the differences whatsoever. So if you can like give a definition of what that is, that would be great.
Sure. So there's definitely differentiating factors. Traditional dentistry has great purposes, great intentions. There's just a little bit of a lesser impact and educational guidance towards systemic implications and understanding the person's health prior to commencing treatment. It's more of a focus on here's the problem, let's find an optimal way to fix it, as opposed to holistic biological dentistry still has that aspect, but they're really trying to find the most natural, less impact way to restore those issues, but then understanding why those issues arose and looking upstream to find a way to prevent those from occurring again. And there's still a distinction there because holistic dentistry is a thing, but it's also a marketing term. And so one of the things that sort of happened over the last probably like 10 years, maybe since like 2010, in general, if you go to a store, a grocery store, doctor's offices, you see the word holistic a lot more. And when you look in dental offices, there is no formal education or no requirement to label yourself a holistic dentist. So due to that, a lot of practitioners, because it is such a buzzword and it's actually becoming a pretty high marketing type buzzword on Google, have started to incorporate that, which has probably, if anything, damaged the reputation of holistic dentistry, because most of these people really aren't holistic, but they're using that as a term to attract new patients. As opposed to biological dentistry, there is a very formal education process. There's a board certification process. There's a much level of higher education, and you have to go through complete naturopathic training and get a naturopathic degree to acquire that. And so we're seeing more holistic dental offices appear, but unfortunately, we're also seeing some of those offices injure people who have predisposing health factors that aren't getting accounted for, where they're getting mercury fillings removed that maybe shouldn't be removed at that time, or somebody would just say, hey, we're holistic because we don't do amalgams, which is a very minor step, but the way they remove them may not be safely, or a lot of the tooth colored composite resin restorations that they may be using have plastic monomers that have been tied with different health issues and even cancers. So even though we still consider ourselves holistic, and I'm part of the Holistic Dental Association, just for consumers, you do have to be careful when you come across a holistic dentist, because they're not all the same.
Yeah, for sure. That kind of reminds me of like the label organic when it comes to vegetables. Like a lot of the regulations just don't kind of match up. It's not up to par. But when you go to biodynamic, that's where it's like the top notch, and it's can't really be compromised in that way. That's what came off for me in that.
Yeah, and it's unfortunate because most people, especially who are first looking at altering their life or maybe came across some kind of life crisis and are now trying to change their lifestyle habits or their dietary habits, they're trying to do the right thing. And they're looking for labels, and they will see, organic, or they'll see, I mean, even worse, natural, right? You see the word natural on almost everything, and it means nothing. And so they're doing this and they're paying more money for these things because these labels, but they're not truly getting what they think they are. And in a lot of cases, it's actually harming them.
Definitely. So when we talk about like the faults of conventional dentistry, um, there's a few things that come up for me, but I'm curious, like, what are the top three things that you see like in conventional dentistry that are just harming people straight out?
Over treatment. So a lack of true prevention focused on remineralization is going to be probably the most common thing that we see, where we'll have patients come in with a treatment plan saying they have 12 cavities. Looking through, maybe they have 2 or 3, and the other ones, with the right kind of treatment outcome and home care, the other ones can remineralize on their own. And when you look at dental care in general, it's an invasive procedure because you're removing some kind of biological tissue and replacing it with some sort of foreign material. And those materials have become healthier and safer. But no matter what anybody says or how advanced these materials get, there's really nothing as healthy as your natural tooth structure, unless that tooth structure has just failed and gone bad. And every time a restoration like that can happen, especially when it gets overdiagnosed, and it's not an ideal material, they will fail with time. And whether that's mechanical forces or the pH of the mouth or the bacterial biofilm, eventually that material will fail. It has to get replaced, and so that will get bigger and bigger. And so when you see a small child who is diagnosed with 12 cavities, who maybe doesn't need all 12, that can be a frustrating thing, just because that will predispose them to issues later in life.
Yeah, definitely.
So that'd be one. The other one I would say is just general material choices. There's a lot of education out there in the United States. Dental amalgams, so the mercury-containing fillings, are still very legal. People use them on patients with autoimmune diseases, with pregnant women, children. We see it all the time, as opposed to you look at the majority of the world, including third world countries, where those fillings are banned, outlawed, out of the country. Pretty much all of Europe, illegal for definitely pregnant women and children. It's not used at all in Scandinavian countries and health-oriented ones. There's countries in Africa that no longer use amalgam. And even with the resins, like we talked about, there are a lot of these monomers. BPA is probably one of the more common ones, and you hear about this in water bottles or plasticware. It'll say BPA free. A lot of dental fillings still have BPA. A lot of dental appliances still have BPA, and dental manufacturers can get around things where they'll market things as BPA free, but they'll often use a precursor like a bis-GMA in there. And the issue is those can turn into BPA in the body. So you could inherently get something that's BPA free, but then it will become BPA. There was actually it was a double-blind cross-clinical study on pediatric patients who had cavities. And there was all these kids, I believe, from age 4 to 8, who had active decay. They got diagnosed by multiple dentists as being decay, and they blindly put in restorations. The kids' urine was tested prior. There were no plastic monomers, BPA free, and they put in fillings that were marketed as BPA free, but they had bis-GMA in them, which is probably the most common substitute you see in dental work, as well as certain plasticwares. And after the restorations were completed and they tested these kids, the ones that had these fillings had positive levels of BPA in their urine for 1 to 3 months.
Wow. Yeah. That's interesting.
More of that. And then lastly, just kind of looking, I would say the biggest gap is people not really looking at causal factors of why problems are happening. And that can be spread out into a lot of different fields. If you have a patient who comes in every 3, 6, 12 months, and every time they come in, there's 1, 2, 3 cavities, it's a very abnormal thing to happen that shouldn't be going on. And we understand as a dentist, part of our job is to restore those so the cavities don't create infection or spread to other teeth. But if you don't really look at the underlying cause, then this patient's going to have the same problem every single time when they come in for the rest of their life. And those fillings will start to fail prematurely just because of the decay that's in there. And there's not as much focus other than floss and brush your teeth on why this decay is happening. And same thing sort of happened with people prone to sleep apnea and arch width, hypoxia, and airway issues, where there isn't a lot of focus on that yet. It's becoming more integrated now, but it's still pretty underserved.
Yeah, it makes sense. When we talk about mercury, I know like it's a good idea for people to get those removed, but isn't there like a certain protocol that you want to go? You just don't want to take them out by anybody. Like there's a very specific thing that you need to go through, so we don't like endure like more damaging to your body. Is that true?
Yeah, so taking them out can be a positive thing, especially some of the older ones. You get the main bad reputation for them, because of the health impacts of the heavy metals. The other thing that happens with these metal fillings is they expand and contract, and they do that very quickly and much more so than your tooth structure does. And so, Anthony, if you've ever seen like a metal pipe running through like a concrete sidewalk, you'll see all little stress cracks that happen around it. And it's because that metal expands and contracts with thermal changes. It's very similar to what those fillings do in your teeth. And when those fillings are in there, when you have exposure to hot liquids, cold, it could be ice water, it could be ice cream, it could be tea or coffee, those fillings are constantly growing and shrinking. And as they do that over time, especially as they age, and normally 3 years is sort of the maximum on them, they have a tendency to fracture the teeth and pull apart from the teeth. Also, when you see those fillings, they are held in solely by mechanical retention. So if there's a small cavity in the top of your tooth, now we can just remove that little cavity and put a very small conservative filling in there. If it's an amalgam filling, you have to remove that cavity, a little tooth structure around it, and then you have to undercut the tooth, meaning so at the bottom sort of base of the tooth, the filling is going to be substantially larger than it is on top. And then they take this mercury based putty and they stuff it in there, and then it hardens. And so they get sort of sharp angles underneath, and they get thicker underneath so they don't fall out of the tooth with that mechanical retention. And there, as those expand and contract, that's where we see a lot of issues with teeth breaking. Sometimes people will just be eating a piece of bread and they're like, oh, I was eating a piece of bread and my tooth broke. It's not the bread that did it. It's just eventually the fracture from the expansion contraction is what gave way, and broke that away. And that's got to get accounted for as well. And so most of those that we're seeing are failed in a number of different ways. And when you're looking at getting these taken out, your systemic general health has got to get taken into consideration. There's some genetic components, looking at MTHFR, MTRR genetics, looking at SAMe methylation profiles, and really understanding what impact your previous dental history has had. So a lot of our patients will be working with us or a functional integrative doctor and do some type of heavy metal profile testing. Most of the tests now are pretty accurate, and they can look at total mercury. They'll look at the mercury burden on the body. But as they do that, it will also show us the difference between the total mercury that's absorbed, and it will differentiate between methyl mercury and inorganic mercury. Two different types of mercury, two different toxicities, two different impacts on the body and excretion profiles. Methyl mercury is normally going to be acquired through diet and environment. And your biggest culprits for that are going to be fish. Rice is a pretty common one, sometimes root vegetables, and water can be as well. And then inorganic mercury is really only found in two places, and that's going to be dental fillings and vaccines. More toxic, harder on the body. But when you look at like fish, for instance, that pathway that us as humans have to help remove heavy metals from our body, it's a really slow pathway, and it's really slow for mercury because it has such a strong binding affinity. But comparing that to the fish just don't have any of that. And unfortunately, most of our waters and oceans have mercury contamination. So the longer the fish is in the water, the bigger it is, the higher mercury content it will have. Plus, it's going to eat the smaller fish. That's why a lot of times you'll see, warnings for people to limit tuna intake, swordfish intake, or try to focus more on eating sardines, anchovies, mackerel, sort of smaller fish. That's really to looking at the methyl mercury content, but that's different than inorganic mercury. And getting an understanding of what those levels are, and then understanding what the body's doing with it. So that capacity that we have as humans to excrete those metals, the more we get exposed to, or the longer we get exposed to it, or if there's a acute, very large dose that we get exposed to, let's say somebody sees a dentist and they have a lot of mercury put in, those cycles will slow down and sometimes get damaged. And when that happens, there's an issue where you can actually get to the point where your levels are going up and you are accumulating more metal than you're able to excrete. If you're in sort of this toxic range and you fall into this point where your body's not capable of properly releasing these metals, it becomes a really poor time to go in for metal removal. So you got to have a basic understanding of that, because when the metal comes out, those systems to help push it out of the body are broken, and it ends up mobilizing it and moving it to worse places. So that's part of the process that, from a health standpoint, one of the factors that's got to get factored in. But in regards to the removal of it, there's 3, maybe 4 main ways of doing it. One is a toxicology protocol that's used internationally. There's actually the Huggins protocol, which the guy who I met on the train, he developed. It's called the Huggins Mercury Safe Protocol. And then there's also a more common hybrid protocol. It's from Switzerland. It's called the Swiss protocol. And those 3 are what we typically will use to remove failed metals from patients. And when you're looking at it from a removal standpoint, mercury is unique in the sense that at room temperature, it can become a solid, liquid, or a gas. And all 3 of those have different impacts on our body. The solid is going to be actually the least toxic. The liquid is going to be substantially more toxic, and the vapor is the most highly toxic. When you're looking at like a mercury liquid, think of like a thermometer. And even back when I was a kid in school, you could open up mercury and play with it on the table in a classroom. And now and this gets reported, if there's mercury thermometer that breaks or mercury's in the school, the whole school gets shut down and guys in hazmat suits come in to clean it up, because we know so much more about the toxicity of it. And the vapor is much more, and mercury can vaporize very, very easily with friction. So a lot of these protocols are really mitigating the swallowing of solid pieces, but really prevention of the vapor inhalation of any off-gassing of mercury in patients who need it.
Awesome. Yeah, it makes a lot of sense. Are you familiar with Dr. Dr. Charlie Brown?
Charlie Brown? No, I'm not sure.
So he's been working on this massive thing to like phase out mercury completely from like everywhere. He works with Dr. McCullough, and
Okay.
like he by 2025 it's supposed to be completely phased out of all of Europe. So that's really exciting, and they're working on like all these different countries. They're making a lot of progress. So it's just really exciting to hear. But in the United States, it's not there yet. But it's I was just curious because it was really exciting. I heard it a couple days ago. So
yeah, so the United States is gonna get around to doing it, but they're gonna be pretty cautious and unique in how they do it, primarily because our American Dental Association, through the American Dental Education Association, owns all the patents on dental amalgam. And so if there was a blanket statement saying that these are harmful, then there's definitely a risk for a pretty substantial class action lawsuit for people supporting it. So my understanding is, even though most of the world has phased this out, there are some issues around here where it's not going to get phased out just by an immediate pullout of it. But what they're now encouraging is there's maybe 3 main manufacturers who make dental amalgams, and they are now discontinuing making it. So essentially it won't be attainable, so it will go away. But I don't think anything in regards to the potential harm or impact of it will ever be released. I think it will just get phased out by these manufacturers by chance stopping the production of it.
Yeah, well, that's a great start. I mean, it's certainly better, right?
It is certainly better, yeah, because we still see like I said, so many children and patients who are coming in just full of recently placed mercury fillings.
Yeah. Another thing I want to get around to, like the unconventional or the conventional, is the root canals. I'm curious, what is your take on that? Do you recommend not doing that, or
Yeah, so
the
when
extractions, or what is that?
yeah, in our office, we certainly will promote tooth replacement and looking at some different ways of looking at extractions. Um, we we work with a couple specialists who do something called a holistic root canal for patients who still want that option. It's not one that we normally are promoting or supporting, but it is an option. When a root canal is done, what a dentist is typically doing is they are using some kind of nickel or titanium drill, and they are extracting the nerve out of the tooth, which creates a pain relief. As they do that, they're normally using some kind of solution, probably most commonly bleach, that they're squirting into the tooth to kill the biological tissues. And then they're using this chemical sort of runny sealer paste and rubber to stuff in the middle of the tooth to seal it up. And when that happens, and even if you read the textbooks on endodontics, the whole philosophy behind it is to get the tooth as clean as possible, remove the nerve to alleviate pain. And if there was a bacterial infection in it, it's going to be impossible to get all the bacteria out. You just can't get it out. You seal it up the best that you can. And then you end up having the immune system work to prevent that bacteria from spreading. And the issue that happens is that's a constant chronic tax on your immune system to fight off this bacteria on dead tissue. So you're left with dead ectodermal tissue that's left in this mesodermal endodermal space that has bacteria on it. The immune system can't really get in to get the source because there's no blood supply left in the tooth. But it can sort of keep it from spreading, and then it kind of works until it doesn't. When you look at a holistic root canal, it's not my favorite term because at the end of the story, you still end up with a dead tooth with bacteria on it. It just is cleaned better and it has stronger, safer materials in it. So instead of using like bleach, they're using lasers and ozone to clean it out. And they're filling the tooth with bioceramics and bioactive things that can release minerals back into the tooth to help keep it stronger. But even with that technology, and typically they're done underneath a microscope for detail, you still aren't getting all the bacteria out. And people who have had autoimmune issues and failure of root canals in the past, that's where they run into issues around it. And so there's a big bacterial infection like that, especially when there's minimal tooth structure left. We're normally going to implement more of a biological option or like a biocompatible implant.
Yeah, definitely. I notice like fluoride being more I feel like in the public eye of something not to use. Like the dangers are becoming more prevalent, in my opinion. Um, like so, like what is the history of that? How did I get in the space in the first place? And also, like what is that really doing? Is that something that we should be using?
Sure. So fluoride got into the space in Michigan, started in Grand Rapids. I think there's actually still a statue in downtown Grand Rapids to the fluoridation of public water. Um, Fluoride itself isn't inherently bad. We need some level of fluoride in our bodies to function, and actually the proper layer of fluoride, which we normally will get through environment and diet, is what we need to help keep teeth strong, bone strong. But it's so specifically dose dependent, and it's so just overprescribed as some kind of magic bullet. It's kind of like a glass of wine. If you have a glass of wine a couple times a week, it has some great health benefits to it, especially if it's like a nice biodynamic wine. But if you're drinking a bottle of wine a night, it's just not great for you. And
Yeah.
what's happening with fluoride is you're getting fluoride toothpaste, fluoride rinses. You go to the dentist, they're using fluoridated products, and they're putting fluoride trays in. And then they're sometimes sending prescription toothpaste with really high doses of fluoride. Um, the whole science behind fluoride is it can embed into the enamel. And the enamel is primarily made out of hydroxyapatite. which is a really dense mineral structure that forms these rods. Well, fluoride can embed into it and form something called fluorohydroxyapatite, which is sometimes even a harder version of hydroxyapatite. And it's also bacteriostatic, meaning it doesn't necessarily kill bacteria, but it prevents the bacteria from growing and spreading. So at the right dose, it does work well, but it's such a minimal dose that if you do too much of it, there are just too many systemic side effects and neurotoxicity, and it can actually make teeth softer. It leads to issues with the pineal gland ossification, and then there's a whole onslaught of things that happen. And so now with remineralization products that have just gotten substantially better using things like hydroxyapatite, nanohydroxyapatite, bioactive calcium phosphate, these trace mineral aggregates. It's just something we don't use and don't need to use in our practice because we're understanding much more about how the tooth remineralizes. And from someone with a healthy diet, you're getting enough fluoride in to internally strengthen those structures.
Yeah, and it comes down to the form as well. Like we're talking
Yes,
about, like naturally it's calcium fluoride, and
exactly.
isn't it like sodium fluoride in dentistry or other places?
Yeah, there's different forms. It depends on the manufacturer. But yeah, a lot of them. There are some forms now which are used by a couple companies, which when they hit the stomach acid, they end up getting excreted and don't get overabsorbed systemically. That's relatively new in the field. But yeah, the forms are completely different when you get it from a natural source as opposed to it's made in a chemical laboratory.
Yeah, wasn't it like originally developed as like a thyroid medication, sodium fluoride?
Yeah, there's definitely history around it. I mean, obviously now we know iodine therapy seems to be much more beneficial. But again, from the fluoride aspect of it, we're still looking at thyroid that's extremely dose dependent.
Yeah, definitely. All right, let's shift gears a little bit and talk about what we actually can do to have healthy teeth overall. Um, Starting with nutrition, like what are some things that we should be avoiding um, for like prevent cavities and things like that? And like what can we do to amplify and fortify our mouth, like with food alone?
Sure. So one of the most important things for diet is proper chewing and density of foods, and this helps with tooth formation, tooth strength, airway formation, jaw formation. When you go back and look at certain populations, probably the most prevalent of these is looking at like a Weston A. Price diet and how that was developed, following a local chapter of the Weston A. Price Association or just following that diet is going to be probably the best for oral facial and dental development, plus just general bone density. Um, a lot of it depends on not eating processed foods, softer foods, simple sugars, simple carbohydrates, and using things that we need a lot of mastication for. And so things that are going to cause us to have to chew it 20, 30 times before we swallow it. That's what our mouths are designed to do. And one of the issues that happens, especially now in childhood and processed foods and just convenience foods, if you watch most people eat, they're going to chew something 3, 4 times and they swallow it. And that's why we see so many concerns with airway and jaw development. And a lot of those foods, unfortunately, just because they are processed, are made out of things that aren't natural and are going to have these simple carbohydrates in there, and those will fuel bacteria in the mouth. Looking at cavity rate and increase, you're essentially looking at microbiology. You in your mouth are going to have more bacteria than you have human cells. It very much so mimics and parallels the gut in that way. And that's part of the way our health is intended to be. So when that bacteria is in balance, everything is relatively healthy and it helps us it helps us taste, it helps us heal, helps our immune response. The bacteria that cause dental decay are relatively unique in the sense that most of them are never part of your innate flora or what's passed down to you. So they're all acquired or transmitted strains, meaning if you have that strain of bacteria at some point, it got transmitted into your mouth. That could be from sharing food, sippy cups at a younger age, bottles, forks, utensils, whatever it might be. But at some point, somebody who had active dental decay shared something with that person, that bacteria got into their mouth. And once it got into their mouth, if oral hygiene wasn't adequate, or there was a lapse in it, or maybe the person was sick or the immune system was low, those type of bacteria are going to get embedded into the biofilm. And out of those strains, we have protocols to get rid of the majority of them, and doing so naturally, partly in the dental clinic, but also really a hard focus on kind of oral hygiene and nutritional counseling at home. But we can get rid of those so they don't ever cause an issue. But there are a few strains that are more pathogenic. They do a better job hiding, or they mutate very readily. And those, if you get acquired, can sometimes be a lifelong issue for them being part of the biofilm. That doesn't always mean that they're going to cause cavities for your whole life. But if there's a lapse in hygiene and you have one of those, then the cavities can come back. And we see this sometimes with younger children, because you can now do different types of bacterial DNA tests on patients' biofilm to see whether or not they've been exposed to these type of bacteria, which ones they have, what kind of plan can we formulate to get rid of them. But maybe a younger child who has one of these strains will have cavities. We'll work on diminishing that number of bacteria, restoring the cavities properly, and then you don't see cavities for a bit. Then all of a sudden, maybe they enter high school or college, and oral hygiene isn't quite as important or as regular as it should be. And then all of a sudden, cavities begin to redevelop, and that's normally a reemergence of that same bacteria that's in there.
Yeah, that makes sense. So there should be like a focus on like real whole foods, and I'd imagine like avoiding like a lot of the vegetable oils and the sugars and whatnot. Sound right?
Yeah, and even in general, I mean, sugars. If it depends on everyone's biofilm, because if you do have some of these more aggressive bacteria in there, even though they can take something like a sucrose, which would be very easily metabolizable by that type of bacteria, they're not going to differentiate necessarily from like a fructose. And so sometimes you'll see a child who has this bacteria, hygiene maybe isn't perfect, but as a snack, they're constantly eating a fruit or a higher glycemic index fruit. And that can also predispose them to decay forming, because that bacteria is going to utilize the sugar in a banana or an apple pretty closely to how it would do sucrose. But certain other strains won't.
Yeah, I thought it was interesting when we were talking about like the density of the food, because like in processed food, like we have like vanishing caloric density, or where like the food is like potentially really crunchy for like one bite and then it turns into nothing.
Yeah,
So
just
we're
kind of
just kind
melt
of
away.
like this soft food, and that really contributes to jaw structure, especially as like we're developing. And yeah, just it's really important to get that in. So that was a good point.
Yeah, there's a really great, relatively recent piece of literature. Actually, this guy is going to be at the conference I'm going to here next weekend. But it's a book called Breathe by James Nestor. And it really goes through sort of the, going back to caveman, jaw size, airway size, nostrils, the way we chew, looking at airway, tooth position, and sort of how it's developed. And they go back chronologically looking at, caveman skulls all the way to modern day skulls, and see the impact that diet's had on it.
Yeah, for sure. Speaking of that, I was about to bring on breath right after that. So,
Oh yeah, that's great.
So when we talk about mouth breathing versus nose breathing, like what are the pitfalls when it comes to mouth breathing, and how does that affect your jaw structure? And like, what are the benefits that you see when it comes to nasal breathing and like overall jaw position and
Sure.
cavities and whatnot?
Yeah, so definitely a massive difference when we're looking at the two. Nasal breathing is going to predispose a much larger palatal space. It's going to create larger maxillary sinuses for retention. And it also helps with just general development of the jaw. When you start looking at mouth breathing, the position of it is going to lead to some atrophy. And the whole area that we're mouth breathing through has a really strong impact on the pH of the mouth and the moisture that's typically retained in the mouth. When you look at remineralization, even though there's a lot of great remineralization products out there, saliva is our natural remineralizer. It has everything our teeth need to stay healthy, pH neutral, and remineralized. But when we're mouth breathing, especially at nighttime, if you think of your salivary flow and then you look at salivary flow throughout the day, It's lowest at night while we sleep because we typically don't need it for the things we do. But it also is going to lower that remineralization capacity. And if you add mouth breathing to that, you end up with a very dry oral environment, and that's going to greatly increase the risk of dental decay.
Yeah, definitely. All right. So we talked about unconventional dentistry. We talked about like pitfalls, nutrition, breath work. I feel like we definitely got a lot out for people in this interview. I think a lot of people are going to get a lot of value out of it. Maybe some things that I never thought about before, like the density of food and whatnot. Thought that was awesome. So if people want to learn more about you and holistic dentistry as a whole, like where can they go for that?
Our website they could go to, which is AnnArborsDentist.com with an S, so AnnArborsDentist.com. In regards to just general good information, looking up some of these things, they have access to PubMed. There's a ton of literature on it. Weston A. Price Foundation for dietary sources, things to avoid, great supplements to use, different types of oils that will help, different vitamin profiles from absorption will help. Holistic Dental Association, which I think is hda.org. They have a good amount of educational and links as well. The IAOMT.org is another great one that has a heavy focus on materials and dental amalgams, but also nutritionally does really well. I would say those would be the most patient friendly, but they also link to other organizations that will be in the same realm.
Awesome. Yeah. Is there any wrap up point you wanted to really get out to the people?
Wrap up point is honestly just to ask questions. My biggest advice for patients is when you're seeing your dentist, if it's your local dentist and you have a cavity or they tell you have a root canal, ask why. Understand why it's happening and what do I do to prevent it happening again, and ask, if they're putting in a material, what is the material? One of the best things you can do as a patient, if you're going to have some kind of medical work done, that could be an implantation of a medical device, or it could be a dental filling, it could be the dental bonding agent that holds the filling in, it could be a crown, it could be a root canal, it could be an implant. Just request an SDS sheet. Sometimes they're called an MSDS or an SDS sheet. That stands for safety data sheet. That will lay out all the materials and the components that are in, for instance, a filling or a bonding agent. It also tells you about different toxicity aspects of those materials. And so before you have something substantial done that, may be reversible, may not be reversible, ask those questions, ask for what the materials are. And as opposed to just, throwing a Band-Aid on a problem, understand why it happened and what's physiologically happening that changed and how do you prevent it from happening in the future.
Love it. Yeah. All right. Appreciate you. This was awesome. Thank you very much.
Yeah, of course. Hopefully we'll get to chat again.
Definitely.